Hello, my name is Melanie Menudo. Today I will be meeting with Ms. S., who is a married 29-year-old female patient. The aspect of the assessment is on attention functioning. Ms. S. has a history of anxiety and depression. However, the issue that she is here to bring forth is one of lacking attention and concentration. The psychological report for Ms. S. was handwritten by a licensed psychologist. Many tests were utilized to understand the reasoning behind the lack of concentration and understanding. Review of records, clinical review, cognitive assessment, Wechsler's Adult Intelligence Scale 4, achievement assessment, Nelson-Denny rating test, wide range achievement test 4, information processing, lexical fluency, semantic fluency, digital span, rough 2 and 7 selection attention test, trail making test, California verbal and learning test 2, the Stroop color word test, Wisconsin card sorting test, personality assessment, Minnesota multiphasic personality inventory 2 restructured form, mood, Beck depression inventory, and Beck anxiety inventory. Even with the long-standing previous issues with anxiety and depression, the ability to focus or have attention has not been an issue until recently. While math, as always stated, is a problem subject for you, it has come to our attention that that may be because of a learning disability. The lack of ability to focus has been an issue since shortly after high school, since it is listed as one of the reasons for quitting college. For the summary of findings, while testing your cognitive abilities, the test shows that you are well within the range of comprehension on both verbal and nonverbal areas, and the lower test scores are in the areas of mathematics, or at times when your anxiety got in the way of your functioning. You performed in the expected range on other tests except in the area of math. You were given extra time on the Nelson-Denny timed reading test, which may have helped your score. Your scores overall on reading comprehension were below the expectations based on current level of education. The test was likely compromised by anxiety, which causes loss of attention and focus. Your information processing ability is well within the range of average. As stated in the opening of the interview, the scores on the arithmetic were lower than the other scores. However, this may point to a general weakness in understanding in arithmetic and not an actual memory impairment. Sustained attention is an area that needs help. You scored the same as an individual that had been diagnosed with ADHD with a significance of 0.01 significance level. Since this is the issue that you wish to address in the testing, it is completely understandable. Your speech was fluent, articulated, and seemingly had no impairments. You also showed no signs of visual or spatial issues. You show no evidence of primary retentive memory problems. You did show a mild impairment in initially learning a list of words that was highly attention demanding. After a delay, you were able to recall all of the information that was on the list. Reasoning, planning, and response inhibition were generally intact. However, your anxiety disrupted the test during the problem-solving portion. You were asked to take the MMPI-2RF to gauge your mood and personality. A pattern was revealed in the later part of the test, which suggests that your anxiety and reduced attention span began to play a part in the answers of the questions. Your responses on the basic clinical scales indicate a high degree of psychological distress at this time. This distress includes symptoms of depression, agitation, and tension over issues within your environment. You may feel alienated or isolated from your social circles. You seem to have a general pessimistic view on life and may be angry about your personal situation and blame others for the issues within your life. Psychological treatment such as therapy is recommended to continue after the stress levels return to normal. The Beck Anxiety Inventory shows the anxiety range in a severe state. The Beck Depressive Inventory indicates mild to moderate depressive mood. However, depressive symptoms did not meet criteria for a depressive disorder. The test results show overall impairment in the sustained attention and working memory. All of the tests show that this is all secondary to a diagnosis of general anxiety disorder. The tests show a significant weakness in math skills that may show a mathematics disorder that has likely been present since childhood and worked towards a general dislike and anxious feeling about math. The results show a disability in functioning that is eligible for appropriate accommodations. You will be given double the time allowed to complete examinations. This is due to the reduced reading comprehension secondary to your anxiety disorder. This accommodation also allows for separate testing room in order to reduce distraction. You will also be allowed to use a calculator on standardized testing due to a diagnosis of mathematics disorder. You will be given extra breaks during prolonged standardized testing because of the above noted disabilities. Recommendations for day-to-day life. By taking frequent breaks from tedious work and making your work environment as distraction-free as possible using noise-canceling headphones, it will create a place of work that will allow you to focus on attention-demanding tasks. Leaving yourself notes in either a journal, daily planner, or on a calendar will help you keep on track. Finish one task before moving on to another. No multitasking. Learn to keep your important items in one place in your home. Do not change the spot once it is chosen. You'll never lose items again. Thank you.